Hemorrhoids are a common condition that can literally affect anyone. And as much as they cause discomfort and pain, there is relief which people can get.
Hemorrhoids increases your chance of cancer.
Did you know, like, if like I sit on a cold surface, or like if I am cold or I'm rained on and I sit down, I might get hemorrhoids?
Yeah. Welcome to Consultation Room Podcast. Welcome to today's episode. So on today's episode, we're going to be talking about something that is often whispered about, and most people don't seek for help because they're too embarrassed. But this affects a lot of people because it's quite common. So we'll be talking about hemorrhoids. So stay tuned. We'll be diving into the common causes, how to treat and prevent it. So if you've been suffering in silence, be prepared to be able to solve it today. Okay, so let's start with the basics. Trudy, what are hemorrhoids?
So hemorrhoids are basically enlarged blood vessels. These can be inside or around the opening of your bottom, or what we like to call the anus. And they can be internal or external. So they can be inside of the rectum, so up your bottom, the pipe that goes up, that's the rectum. So they can be inside of that, or they can be under the skin around the anus. So just to give you a better picture, the anus is normally lined with spongy tissue and blood vessels, and these are called cushions, anal cushions. And what they do is they help the anus to close. So sometimes when you go poopy, you're thinking, oh, like something's no, there's some cushions there that will help close and open. But sometimes if you have blood vessels in this area that are enlarged, you might experience the symptoms of hemorrhoids, or what we also like to call piles. So that is the simplest definition of hemorrhoids. And there is always some symptoms with a lot of these things. So Steph, what are the symptoms when it comes to hemorrhoids?
Yep. So when it comes to hemorrhoids, the typical symptoms that you will experience are, well, you may experience, not you will, you may experience that bright red blood in your stools, an itchy anus, feeling like you need to poo after actually going to the toilet. And sometimes you may find out that you may have some mucus under your underwear or on the toilet paper after using the toilet. You may also get lumps around the anus or pain around your anus. But when it comes to symptoms of hemorrhoids usually also depend on the type of hemorrhoids you have. So although these are the typical symptoms that I have listed, depending on the type of hemorrhoids you have, it depends on the symptoms you have. So I'll go into some of the symptoms that you may experience with each hemorrhoid. So we do have the internal hemorrhoids, which are usually inside, so you can't really see or feel them, and they rarely cause any discomfort. But when you strain, or if there's some sort of like irritation when passing stool, it can cause painless bleeding. So that's when you may find the white blood in your stools. And you may also have a hemorrhoid who push through the anal opening. So this is usually called like the prolapse or protruding hemorrhoid. And this may result in pain and irritation. We also have another type of hemorrhoid, which is the external hemorrhoid. So these are under the skin around the anus, as Trina mentioned. And symptoms of this may include the itchiness or irritation in the anal region, and pain or discomfort, swelling around the anus, and bleeding. So sometimes as well, the external hemorrhoids may get blood clots in them, and this is what is known as the thrombosed hemorrhoids. So this form of hemorrhoid is usually one that causes a lot of pain. It's extremely painful. You get a lot of swelling as well, a lot of inflammation going on, and a hard discolored lump near the anus. So sometimes you may find that some patients have maybe just the internal hemorrhoid or just
Yeah.
the external hemorrhoid, or some patients may have both, unfortunately. So, yes, that's what normally happens. So, I have mentioned some few things, if you were listening, about this, what could cause a hemorrhoid. So, but
Yeah.
Trudy, do you want to go into details as to what? Oh, actually, before we get into the causes, there's actually something I
Okay.
wanted to mention. So I did mention that with hemorrhoids, you do notice blood in the stool, but
Hmm.
it is crucial to note that not all blood in the stool
Is.
results to a diagnosis to hemorrhoid. It could
Yeah.
mean something else. So
Yeah.
if you are experiencing blood in your stool and any
Mhm.
changes in your bowel habit, please seek your doctor. This is really, really important because often some people, as soon as they
Yeah.
notice that there's blood in the stool, they think it's hemorrhoid, but it could be something else. And that could literally result in a delay in diagnosis of something more serious. So yes, I just wanted to add that in there. So do you mind going through some of the causes of hemorrhoids?
Okay.
Yeah.
So, as we said just previously, hemorrhoids or PALS can actually be caused by swelling of blood vessels. Now,
Mm,
this can actually normally happen if there is a few things that's happening. So, if let's say you're straining to go to the toilet because of
yeah.
constipation, so if you're constipated and you can't go to the toilet and you're really, really straining, so what you're doing is you're putting so much pressure in your blood vessels, these can cause you to have hemorrhoids. So that's one of the main and probably the
Mhm.
most common reason why people might have hemorrhoids.
Yeah.
Another reason is if the anal canal is actually weak, and this normally happens with age. As you get older, your anal canal may become a bit weak, and what could
Mm,
happen is the blood vessels around the anal canal or in the anal canal may swell, or they just may be inflamed, and that could
mm,
cause hemorrhoids. So that's another reason, especially in older people. This could be it, but again, in older people as well, most of the time they get constipated, so that might be one of the major reasons. Another
mhm.
reason or another cause of hemorrhoids would be if you have a persistent cough, believe you me. So if you're
Mm,
constantly coughing, what you're doing is you're putting so much pressure. It's like
yeah.
sometimes when you've experienced this stuff when you've been pregnant, for
Yeah.
instance, and you're
Yes.
coughing so much and
Mm,
something comes out. So basically, the reason I'm saying that is sometimes when you're coughing, you're putting so much pressure down there,
yeah.
and that could make the vessels or the veins in your anal canal to swell.
Yeah.
And of course, when the veins swell, this can cause hemorrhoids. So as we've mentioned before, it's all about swelling of the veins or the blood vessels in the
Yeah.
anal canal that can cause hemorrhoids. So anything that could cause that is possibly going to cause you to have hemorrhoids. Not to say that if you have a persistent cough, you will definitely get hemorrhoids, but it can lead
Mm,
to that. Also, if you
yes.
lift heavy objects, you can get hemorrhoids because again, it's that pressure you're putting down there.
Yes.
So
Yes.
I always talk about manual handling at work, and people probably look at me and they're like, "Oh God, what is she on about?" Because this is so important. How you lift
Mm,
things is very important, and also lifting not more than you can actually is very important. So if you're constantly lifting heavy objects, you could be predisposed to having hemorrhoids. So these are some of the common causes of hemorrhoids, but not to mention pregnant women. Pregnant women are
yep.
very likely to have hemorrhoids. Part of the reason
Yes.
is because there is a lot of pressure in sort of the tummy area, and
Mm,
basically you're pushing down towards sort of, the anal canal as well, or the baby is
mm,
pushing towards the anal canal, and so these vessels around that area can actually also become inflamed, and you could have hemorrhoids. But
yeah.
the good thing is, this normally resolve after you've given birth. So if
Yep.
you're experiencing this, if you're pregnant, you're experiencing this, the good news is once you've given birth, it's likely that this will resolve. So those are the main
Yes.
common causes of hemorrhoids. I don't know if I've
Yes.
missed any, Steph, that you've come across or any that you
Mm.
know of that I've not mentioned.
Yeah, I think no, you've mentioned most of them. The only thing I would add are like obese people, because again, like the
Yes.
obese, they are having putting a little bit of pressure on like the rectum as well. And
Mhm.
I'm not sure if you mentioned about having like chronic diarrhea and constipation as well, because you're
Mhm.
constantly going
Yeah.
and basically like putting a lot of pressure like with the
Mhm.
opening and back and forth of like the rectum.
That's true.
And obviously what is going to cause like constipation, like eating a lot of like low fiber diet and stuff,
Mm.
that yes. But there's one thing which you didn't mention, but having anal intercourse unfortunately put you at risk.
This Well, I was reading a lot more about that because they
Mm,
say that, but not that I am here for it or I am here supporting it. Listen, do
mm,
you? But I think what they said is it can increase the chances of it, but it doesn't necessarily
mm-hmm.
cause.
Yes,
Hence why
yes,
I didn't
yes.
mention it as a cause.
um yes, yes,
So
it
I
is,
think
yeah,
when we talk about sometimes who are likely to get it,
to get it.
this could be this we could put this under that group.
Yes. Basically, yes.
Yes.
Yes, yes,
That's why I
yes,
didn't
yes.
mention it yet. But yes,
Oh,
you are right.
yeah, that's it.
Okay.
And yeah, yeah, but those are the main ones I will put out there. Yeah.
That's good.
Um,
Yeah.
yeah. Hmm.
I mean, to be fair, if you, let's say you've had hemorrhoids from other reasons or other causes that we haven't mentioned, we'd really like to know this. So please drop
Yes.
us a message, let us know, because hemorrhoids is one of those things that I feel like it's still being understood. You know,
Mm,
so the causes of it is still ongoing. Like what
mm,
could be causing it? I feel like is something that's still
yeah.
being researched and stuff. Well,
Yeah.
I'm sure there is treatment for hemorrhoid stuff. So, what are we looking
Yes.
at when it comes to hemorrhoids?
So when it comes to treatment for hemorrhoid, I like to group them in like sections.
Mm-hmm.
So first you need to like treat, like because we said constipation helps, treat your constipation, something to help
Yeah,
with constipation. So to help soften up the stool, so make sure you're eating loads of like food with like high fiber.
yeah,
You could take some fiber supplements, and also your pharmacist may give you like a mild laxative just to help soften up like the stools.
mm-hmm.
And we do have some topical treatments as well to ease the pain and itching and swelling of hemorrhoids. So you may notice the common one, which is like anisole. I'm sure
Mm-hmm.
everyone knows about that. So some
Yeah,
come as a form of like creams, ointment, and we do have like the suppositories as well.
mm-hmm.
And some of these hemorrhoid creams as well may contain like local anesthetics just to help like numb and
Yeah,
ease the pain. Yes. So they contain something like lidocaine.
yeah,
And so I would say if you are going for like a hemorrhoid cream with lidocaine, actually only use it for a few days, because otherwise
yeah,
they may affect like the sensitivity of your skin. And we do also have products containing corticosteroids, which help with like the swelling and again like the pain of the hemorrhoid. So you
yeah,
may, so these products may include like anisole, HC, and there may be some prescription only medications as well. So these ones that I've mentioned, like the anisole HC, you can obtain over the counter. But let's say,
yeah,
for instance, they're not helping. There are some steroids that you can obtain a prescription for, which is like the proctoside or the Uniroid, those sorts, and they help as well. Um, when you do use steroids, I would say only use it for like a week or so, because they do have the tendency of like thinning the skin,
yeah,
and they can damage the skin like around the anus if you use it for so long. So
yeah,
if it's not going for like a week or so, just see your doctor. Um, we do, when it also comes to like the pain, we do also advise patients that they can opt for like OTC, over the counter painkillers like
mm-hmm.
paracetamol.
Yeah,
One thing I would say is never go with like a codeine-based painkiller, because codeine-based painkillers, they cause constipation, so they're not going to help with your hemorrhoids. And if you're also having a hemorrhoid that causes bleeding, don't go for ibuprofen as a painkiller, because it's going to increase your risk of bleeding more. So always opt for paracetamol.
Yeah.
Another treatment is, because you're in pain and there's a bit of swelling, usually a warm bath, or they say you sit in the bath, which is called sitz bath. It usually helps as well, keep your hemorrhoid at bay. We do have some hospital treatments if these medications are not working, and these like home remedies are not working. So with hospital treatment, we do have some that are surgery and some without surgery. So when it comes to without surgery hospital treatment, we have the rubber band ligation, which is
Yeah.
basically they place like a band around like your pile, like your hemorrhoid, and then it makes them drop off. And then we have another type of intervention called sclerotherapy, which is when a liquid is injected into your piles to make them shrink. And most of these therapies, actually, that I'm going to mention, they usually just cause the hemorrhoids to shrink, basically. And there's another one also called electrotherapy.
Yeah.
And there's just a gentle electric current that is applied to your piles to make them shrink. And another is an infrared coagulation. And
Yeah.
infrared light is used to cut like the blood flow to your piles, making them shrink once again. So when it comes to surgery, which is another form of treatment, we do have the surgery where they take away, they cut out your piles, which is called hemorrhoidectomy. Hemorrhoidectomy, which is
Yeah.
basically cutting out the piles. And then they have one where they also staple the piles back inside your anus, which is called
Yeah.
stapled
Mm.
hemorrhoid dupexy. And another form of treatment that you may get is hemorrhoid artery ligation, which is just stitches are used to cut out like the blood supply to your piles to make them shrink.
Yeah.
So basically, when it comes to treatment, we do just to round it up, we have the over-the-counter treatment, and which contains like the cream, the hemorrhoid creams, ointments, and suppositories, and some topical steroids. And we also advise some dietary lifestyle, which is the treat your constipation. And also you have your non-medical treatment, which is the surgery and without surgery. Yeah. Is there anything else to add with treatment?
No, I think you've mentioned all of them. I
Yeah.
couldn't add any more. But what I can
Yeah.
say is, I know we've mentioned anusol, because that is the most common.
That's
But
so
it doesn't
common.
necessarily mean that you can just get that. So if you go to a chemist and you ask for anusol and they don't have it, don't walk out. Speak to the pharmacist. They will advise you on what else there is, because there is things like even Germaloids, which is just as good. So there is a few other brands or options that you can
Yeah.
get for like the like creams and ointments and suppositories that would still
Yes.
help. So what I would always say is speak to a pharmacist, go to the chemist, speak to the pharmacist. They will be the best people at giving you the
Yes.
best direction and the best way forward.
Brilliant.
Yeah.
We have spoken about treatments. So what can an individual do to help them prevent them from getting a hemorrhoid, or even reduce their hemorrhoids?
Likelihood.
Yeah.
So I think we've mentioned constipation being one of the major causes of hemorrhoids. So basically, what you need to do is to be less constipated, and the only way to be less constipated is to eat plenty of fiber, plenty of food,
Yeah.
plenty of veg. Go to our podcast episode on constipation, listen to that episode, because that will really
Yes.
help. Basically, you need to make sure that your digestive system is as healthy as possible, and also drinking plenty of water. So just making sure that you tackle constipation or you prevent constipation. That is one of the ways of preventing hemorrhoids. So that is that is key to actually preventing hemorrhoids. So just eating fiber-rich foods is very, very important. And also, as we said, drinking plenty of water is very, very important. Now, water actually also just helps keep poo soft. So as much as it helps with hydration, all of that, it also just helps your fecal discharge to be a bit softer. That way you're not straining to go. So water is very, very important. Keeping hydrated is very, very important. And also just cutting down on caffeinated drinks and also tea and coffee, because what these things do, they can actually cause you to be a bit more constipated, and they might take some more water from your fecal discharge. So you want to maybe cut down on these things, because that can actually increase your hemorrhoids.
Yes.
Another thing people can do is limit alcohol consumption, because alcohol, people don't realize it. Like when you've been out drinking, you're like, oh, I'm so dehydrated. That's exactly what's going on all over your body. So even your poo is going to be, it's not going to be as soft. There's not as much fluid in there. So you're going to be very, very constipated in the long run. So limiting how much you're actually drinking, how much alcohol, you're actually drinking is very, very important. That is also one of the key ways of preventing constipation, hence preventing hemorrhoids. And also regular exercise. We always talk about regular exercise, and as much as it is, good to just keep you fit and prevent cardiovascular diseases, it does prevent a lot of other things, and hemorrhoids is one of this. It was one of those things, because what you're doing is, people don't realize that when you're exercising, it's not just your abs and your legs. No, every muscle is being exercised. So even the muscles in your anal canal are being exercised. And what that means is, when you're having to go, when you need to go, you will go easier if you have been exercising and your muscles are a bit more relaxed than if, let's say, you've not had any exercise. Your muscles are very, very sort of like, they're very, they're not loose, and that way you will be constipated, because there is nothing to sort of push, that fecal, mass down properly. So exercise is literally so important. So these are the key things. It's just things that we do every day. These are very, very key in preventing hemorrhoids. And what I would also say is, if you have hemorrhoids, if you tackle it as soon as possible, this could actually help prevent it from actually getting worse. So if you notice that maybe you have, something, going on down there, or maybe you're feeling a certain way down there, or maybe you're actually feeling the hemorrhoids, because you can actually feel some hemorrhoids. You can feel them hanging, or you can feel, a little bulge, in your anal canal, or, in your anus. Get that checked. That will prevent any sort of like complications, or even things like surgery. So those are my key ways of preventing hemorrhoids. I don't know if there's any others, Steph, that you have in mind, or I haven't mentioned.
I think just wanted to add a few things. You said about the exercise, and I was just thinking, what if someone cycles and they have pals? That is their way. That is their way of exercising.
Get that cushion. Get that cushion. So because we know we kind of have an idea now of where hemorrhoids are. It can be uncomfortable, even say if you have an office job, right?
Exactly.
And you're constantly sat down. You might want to get a cushion that is, something that is comfortable, to just give you a little bit of that extra relief from the discomfort of it. So yes, I'm glad you mentioned that.
Yeah. And speaking of people sit for long and stuff, for instance, if you're in office, people let's not mention names, like our partners who spend so long in the bathroom, please avoid sitting for long, because also sitting in the bathroom for long is putting a lot of pressure in your anus as well. So that could put you at risk of, getting hemorrhoids. And I think, there was one thing which I also wanted to add. I think if you have hemorrhoids as well, it's important to keep your anal region like really clean and just
Clean.
wipe yourself with like some
Mm,
damp warm toilet paper just to help,
yeah.
otherwise it might make like the hemorrhoids worse. So these
Yeah.
are like the only few things like I would just add to prevention, but you've
That's
said most of it. Yeah.
That's a good point. That's a good point, actually. And also, they
Yeah,
do have wipes for that now. I think
exactly.
one of the treatments for over-the-counter treatments for hemorrhoids, they do have wipes that you can use just to soothe
Mm,
that area after you've been to the toilet. So that is actually
yeah,
is a very, very good point. And I mean, that can also be in a part of treatment. You know, part of treatment is
yeah.
also just keeping that area as clean as possible and also just
Mm-hmm.
soothing that area.
Yeah, yeah.
Yeah,
Eh, yeah, I guess you could
that's
use
good. I'm
ice
glad you
pack.
added that to that.
Yeah. Yeah. Brilliant. Is there any like myths out there regarding hemorrhoids?
Yes, there's always myths. You know, especially when it comes to something that is uncomfortable, something that
Mm,
is, you know, taboo, there's always going to be people who are going to have myths about this. So
mm.
I've definitely heard a few. I don't know about you.
Okay. Yeah, there are a few there, but I feel like I only wrote down like one main one because that was
Okay.
something like I really wanted to debunk. Um Okay, I'll just go and I'll leave it for you. So, like the one that I got on here is hemorrhoids increases your chance of cancer, because I've actually heard quite a few people say this, like
Mm-hmm.
even like my household, like friends, they have said that. So,
Yeah.
and I feel like this is what makes people scared or even worried to talk about hemorrhoid, but there's
Mm-hmm.
no medical backing to say that, oh,
No.
hemorrhoids can lead to cancer. But I think because like you people get like the bright red um blood in their stool, and
Yeah.
that's what makes people worried. There are loads
Yeah.
of like cancers that causes blood in stool. That's why
Mm.
I said if you do have like any blood in your stool, don't just um go
Equated
assume
to
that
hemorrhoids.
it is hemorrhoid. Always
Yeah.
get a doctor's opinion, like a physician opinion as well, just to say, okay, this is what you've got. So never assume that, oh, just because you've got blood in your stool, it's some sort of like bowel cancer, it's hemorrhoid. No,
Mm-hmm.
yeah.
Mm-hmm.
Yeah, so that's like, and I think because of that, people, like, let's say for instance someone says, oh, they've got blood in their stool,
Mm-hmm.
and it actually makes them miss their diagnosis. So because they've seen like because there's presence of blood in their bowel movement, they automatically assume it's relating to hemorrhoids, but no,
Yeah.
and that could like result in you being delayed. um yeah,
Correct
so
diagnosis.
that's one thing.
100%.
Yeah. Yeah,
100%.
so that's
I'm
one
glad
thing
you
I think
actually
I
mentioned that
felt
because it's
like.
just made me think about something. You know how when
Mm,
you're constipated, we've said constipation
yeah,
can actually cause hemorrhoids, right? So
yeah.
if someone is constipated and they're going to the toilet and they're really, really straining, what could happen is they
Mm,
could tear maybe like a wall and then you might get some
exactly.
blood. It's not necessarily
Mm-hmm.
from hemorrhoids, neither is
Exactly.
it from bowel cancer. It could just mean that maybe
Exactly.
because of your constipation, you've
Mm-hmm.
just just stripped a little bit of
Mm-hmm.
of skin there, and that way you're bleeding. So it can be quite confusing because someone who's constipated might think, oh my god, I've got hemorrhoids because there's a bit of blood.
Exactly.
No, it could just mean because of your constipation, you're straining
Yeah.
so much that you've just sort of like ripped a little bit of skin there, and that
Mm,
could be causing the bleeding.
exactly. Yeah.
Yeah, I've
Is there
heard
any
some
more?
things
Yeah.
about hemorrhoids.
Mm-hmm.
Hmm.
Okay.
So, I've heard that only old people get hemorrhoids.
Hmm.
I think,
Because we said, yeah, the
mhm,
risk factors. So I think that's where it's coming into, because we said as
yeah,
you age,
yeah.
yes, it
But I
puts you
think
at risk.
also because old people, let's be honest, old people don't care. You've got a condition, you go to the doctor, you go to the
Mm,
pharmacy. So most of the patients, I don't know about you, but most of the patients I've been old people because they don't
yeah,
like really
they
want
don't
to like
care.
get the treatment. Maybe they've gone to the
Yeah,
doctors. I don't know if the doctor has said to them, go to the pharmacy, get something for hemorrhoids. That
yeah,
is hemorrhoids. So they'll come in. Whereas young people are thinking,
mm,
I'm a bit embarrassed.
yeah.
So
Yeah.
there's that, myth that it is just old people who get it. Children also get hemorrhoids.
Children, yeah, because they're always
Little
holding in
children.
their poo, so
Exactly.
it gets them
Their
constipated.
bowel habits are different.
Yeah,
They don't want to
yeah.
be, they don't want to go, or maybe they want to play, so they're
Mm-hmm.
gonna hold. Yeah.
Yeah.
So that is one thing I've heard. Like
Mm-hmm.
even in pharmacy, from some dispensers, they've said, "Oh, I thought that is only old people who get it," and I'm like, no, anyone can get hemorrhoids.
Yes. Mm-hmm.
This I actually heard. It's funny. I heard this about 3 months ago.
Okay.
So one of my friends, she was a bit late to work, and then it was a really, really rainy day. So she came in and she had basically changed everything. Like she had gone in like home and changed everything because she had got rained on. And
Okay.
then I was like, oh, okay. So like, what happens? She's telling me, and then she said, well, I have to be careful not to stay wet because like when you're wet, you can get ill. I was like, that's true. And then she goes, did you know that if like I sit on a cold surface, or like if I am cold or I'm rained on and I sit down, I might get hemorrhoids?
Yes, I've heard that. Yes.
You've had that as well, like sitting on cold
Yeah.
surfaces or sitting on like something cold could
Yeah.
cause you to have hemorrhoids.
Yes, 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 yes. I've heard that.
That is a
Yeah.
myth,
No,
guys. That
that's a
is a
myth.
myth. In fact, if you think about it, like a cold surface might actually help shrink some of the veins a little bit. So maybe it might actually
And it'll
help with
soothe
hemorrhoids.
it. Yes, it'll soothe it. Yes.
But that is definitely a myth.
Yeah,
Yeah.
yeah,
Yeah.
yeah.
I mean, people talk about all kinds. And I think she said, no, actually, she did say, my mom used to say when you were young, don't sit on the pavement, you're going to get hemorrhoids, something like that. So I was like, I'm sure that is not true. She's like, I think it's true. And she was convinced it was true. And we had to literally look literature up to convince her that, no, her mom was just telling them, don't sit on that pavement because you're going to make your trousers dirty.
Oh,
Nothing to do with
bless.
hemorrhoids.
Oh.
Another thing I've heard is that spicy foods can give you or can cause hemorrhoids. Have you had that?
I've heard that as well, but no. Yeah, spicy food gives you like the runs and stuff, but
It can, yeah. Or any
yes.
digestive, problems,
Yeah.
maybe ulcers if it's too spicy.
Yeah.
But hemorrhoids? No, that is
No.
not true.
Yeah.
Now, again, if you have the runs, as we said, you could have hemorrhoids. So it's not the spicy food that's caused that. It's maybe just, the complications of some of these things.
Yeah, and like maybe the frequent of going, that's what increases your risk of it. Yeah.
Yeah, exactly. The last thing I've heard is that hemorrhoids cannot go away without treatment. Like you have to get treatment for that hemorrhoids, otherwise it will never go away.
Oh, okay. No, there are some hemorrhoids that do go away on their own, and also by
Exactly.
watching like what you eat and stuff, and just they will go on their own. Yeah.
Yeah, the
But
body
obviously
is
not all of
clever.
them. Yeah.
I always say the
Yeah.
body is so clever that
It
because
is.
these blood vessels have swollen, or they there is that inflammation in the blood vessels. If not everything else resolves, this also will sort of like just that inflammation will reduce, or the swelling will go down, and of course that will clear the hemorrhoids. So that is not true. Some of the hemorrhoids can, as you said, can go without treatment.
Yes.
Yeah.
Yes.
Well, there's one
Brilliant.
thing we didn't sort of like just speak about, but I think we can just speak about very quickly, which is who are likely to get hemorrhoids. What group of people are likely to get hemorrhoids? Is there any? I know we've said that we've already debunked the myth that okay, only old people can. As we've said, old people are likely to because of the anal canal weakening with age, but who are likely to get hemorrhoids?
Okay. I think, yes, you've said age, like the old people, and we also mentioned the kids as well, because kids tend to hold on their poo. There's another group that we have mentioned if you have been listening, but pregnant people as well.
Yeah.
Women can also likely get hemorrhoids because of the weight of the fetus.
Yeah.
They put the pressure on your rectum. So
Yeah.
yes, pregnant people, obesity, we did mention that as well. But
Yeah.
if you also have come from a family where they do get hemorrhoids, that could also be a risk factor. So family history is a risk factor. But these are the main ones. Obviously, anyone can get hemorrhoids, as we have mentioned, but these are the
Yeah.
main ones. Yeah. Is there
Yeah.
anyone else to add? Yeah.
No, I think that's all of them. And of course, as we said, if you suffer from chronic constipation, so
Yeah.
if you've realized that maybe you're constipated for a very long period, or you actually suffer from chronic constipation, you are likely to get hemorrhoids. But anyone can get hemorrhoids. It could be a one-off
Yes.
thing, or it could be something that is recurrent. You constantly getting hemorrhoids, but anyone can get hemorrhoids.
Yes. Brilliant. And
Right.
yeah, I think that's it. Do you have anything else to add?
No, I think
Okay.
we've talked about everything there is to mention when it comes to hemorrhoids. But of course, if there's any questions, we would be very, very grateful to get just to see if there's anything else that we haven't touched. And of course, if anyone has any stories to share, as embarrassing as it might seem, please get in touch with us, or just put your story out there and tag us. We would like to share some of these stories. But no, I think we've mentioned everything when it comes to, and everything that matters when it comes to hemorrhoids.
Okay.
Yeah.
So what would be your take-home message?
So my take-home message when it comes to hemorrhoids is hemorrhoids are a common condition that can literally affect anyone. And as much as they cause discomfort and pain, there is relief which people can get. So with simple lifestyle changes and proper care, regular hydration, as we've mentioned, a high fiber diet, and also mindful bathroom habits, these things can go a long way in preventing and managing the symptoms of hemorrhoids. And also what we've said is early intervention will play such a big difference in improving quality of life and preventing further complications. So if you have hemorrhoids, or if you know someone who has hemorrhoids, it is not an embarrassing condition. It is something that's very easily managed. But if you feel like you are embarrassed about it, this is an episode for you. Send it to your loved ones. Make use of all the information we have shared in this episode, because hemorrhoids, to be fair, is not something that should be embarrassing, and is something that is very, very easily managed.
Yeah.
What about you, Steph? What is your take-home message when it comes to hemorrhoids?
Yeah, I think you've really put it out nicely. I love the way you rounded it up. Honestly, as you said, hemorrhoid, we shouldn't be embarrassed about it. Do talk about it. If you do have it, don't shy away from going to your chemist or your doctor just to ask for an advice. It is something that is so common and is treatable. We can help you manage it. You don't need to be suffering in silence. Do watch our episodes so that you know what to do to prevent you from getting hemorrhoids, or if you do have hemorrhoids, just to help you reduce the risk of it getting worse. Okay, so please do listen up. Any dietary advice that you need to take on board, please do. Any treatment that you need to get, do speak to your pharmacist about, do speak to your doctor. Don't leave it so that it's too late, where you do have to have other interventions taken upon your pals, such as the surgery and the non-surgical procedures. But make sure that you do have that early intervention when it comes to your hemorrhoids. But thank you so much for listening to this this episode. If you are listening, make sure that you follow us, you share. If you are watching, please like, comment, subscribe, share to your friend, anyone that would benefit from this. Thank you. Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.